Good morning. Good morning. Good morning. Thank you for being here. Thanks, as always, to Jay and Vicky for interpreting for us. Thank you for being here.
Gonna
Thanks,
run through the
as
numbers.
always, to Jay and Vicky for interpreting for us.
So as of today,
Gonna
the
run through the
total
numbers.
count
For positive cases in
So
Hamilton
as of
County
today,
stands
the
at
total count
12,368
for positive cases
in Hamilton County.
The change from last
stands at
week is
12,360. The number of hospitalizations in Hamilton County stands at 1,092. The increase from last week is 25. And the total number of deaths in Hamilton County is at 302. The increase from last week is 14. Some of you may recall that the numbers week over week last week in those two categories, the hospitalization and death, were pretty low. But we are now kind of back up to where so we think maybe that was an anomaly, a little bit of a blip in the data, and so we are back to kind of our standard plateau that we've been at really for the last few weeks. So one thing before I talk about who is here today, the Health Collaborative, as of this morning, sent an email out about an increase in positivity rates in certain neighborhoods. Remember that we're partnering with the Health Collab and hospitals to go into hotspot neighborhoods, congregate settings, where we have seen an increase in positive cases and go in and provide testing so that we can tamp down the spread. And so we are doing that in the areas around Mount Auburn, Corryville, and Cuff. So as you can tell, those are near the university, UC, and so they are going in and providing additional testing because we know that there's an increase in positive cases there. So that's exactly what the Health Collab and the county intended to do, and so this is the first time, I think, where we've seen that kind of increase and going in with the increase in testing. So this morning we have Dr. Steve Fagans with us. So I liken Dr. Fagans to Dr. Fauci. I hope you appreciate that because he is like the local version of Dr. Fauci. And so he knows everything about COVID-19, about the health consequences, about what we're doing on the health side. And so we're really glad that Dr. Fagans could join us this morning. He's the medical director of Hamilton County Public Health, amongst other things. And so he is going to run through the numbers. Greg Kesterman is not here this morning. He had to jump on a different call. And so Dr. Fagans is going to run us through the numbers and the trends and show us the graphs. And we're also going to talk about other things. So he will give us an update on current trends, discuss the free testing sites, and preview plans for COVID vaccine distribution when one is developed and approved. Dr. Fagans will be joined by Nick Crosley. He is the director of the Emergency Management Agency here at Hamilton County. He is going to talk also about the vaccine distribution and discuss the EMA preparations to receive, store, and distribute vaccines. So we're talking vaccines today. I've gotten a lot of questions about whether or not the county is getting ready once a vaccine is available for the storage, reception, and distribution of the vaccine, and so that's what we're going to talk about today. First, I have a few announcements. So today, Duke Energy is resuming residential customer disconnections. The company has a variety of payment options and financial assistance programs available to customers. If customers don't take action now, those opportunities may not continue to be available in the future. So please call Duke Energy at 800-544-6900. I'm going to say that again. 800-544-6900. Please call Duke Energy. I know they are open to this idea of making a payment plan to make sure that people can continue to pay those utility bills. Also a reminder that the county is offering several programs to help. So for more information, please contact CAA, the Community Action Agency, at 513-569-1840. And that information can be found on the county's website. Remember, the county is offering rental and utility assistance for residents of Hamilton County. You do need to qualify for that assistance, but please go to the county website or to the CAA number and make sure that if you need the assistance, you're getting the assistance that you need. finally, an update on the census. We've talked a lot about the census, and we're running out of time. So this is we've got some rates for you. There is a combination of self-completion rates and other information gathering, but we've been talking about kind of comparing ourselves to the last cycle. And so the self-completion rate last cycle was 67.2%. The self-completion rate right now is 67.3%. So we're 0.1% higher than last cycle, but that is not great news because we are still undercounting people. And so out of 800,000 people in Hamilton County or so, we still need to find and count 64,000 people in the next 2 weeks. The deadline is September 3rd. Full stop. No more door-to-door, no more online reporting, no more phone or mail. We know that for every person that's not counted, we lose $1,800 in federal funding. That's funding for schools, for roads, think the Western Hills Viaduct, and hospitals. 64,000 times 1,800, which is the dollar amount, over 10 years is $1.1 billion lost if we don't get counted. So there is an urgency to this. Our self-response in the county is almost the same as 10 years ago across the whole county, but inside the city of Cincinnati, the response rates are down 3%. We need a big push these last 2 weeks to show the growth that we know is happening in the county and especially in the city of Cincinnati. So on the screen, I believe, we're showing the self-response rates by neighborhood. What is, did I say something other than September 30th? Okay. All right, I'm getting a note flashed at me. All right, so the deadline is September 30th to report to the census. I apologize if I misstated that. I'm reading it. I don't know how I misstated it, but I must have. So now you can see the map of the response rates. So the darker, the better. So you can see some of those light areas in the city especially. And I'm going to read off some of these neighborhoods. I'm going to do it as slowly as I can, Jay. Lincoln Heights, Lockland, Arlington Heights. As you can see, some of these are outside the city. The areas around Xavier and UC, Carthage, College Hill, parts of Oakley, and downtown. So those are some of the neighborhoods where we need to do an extra push to get folks counted. So especially if you live in one of those neighborhoods, please visit the census. You can do so by going to my2020census.gov. my2020census.gov. Takes 5 minutes, I promise. Fill out the census. Or you can call 844-330-2020 to respond by phone. Please do this. The stakes are high. We're running out of time. The deadline is September 30th, so we're bumping up against that deadline. So please, so that we can receive the resources from the federal government that help with all of these important projects in Hamilton County and the city of Cincinnati. All right, so now I'm going to hand it over to Dr. Steve Fagans, Medical Director of Hamilton County Public Health. He's going to run through the numbers and talk to us about vaccines.
Thank you, Commissioner, and thank you for stepping in for our Commissioner Greg Custerman, who has to be elsewhere, but I'll also talk about vaccines. Thank you for the kind comparison to Dr. Fauci. I was actually on a call. We're on a lot of calls these days. I was on a call, and Tony Fauci joined us, and he was trying to pump us up locally, and we were like, no, sir, we need to pump you up. And so we do maintain a great infectious disease collaborative here locally. Every Thursday, all the infectious disease and infection prevention directors and medical directors of all our systems meet together to determine what we're doing. So it's just one more thing that we do collaboratively. I believe our first slide is the testing sites. And so as mentioned by Commissioner, that through the collaborative and through the Hamilton County's testing initiative and to the CARES Act funding, the pop-up testing sites are really dictated by the prevalence in those areas, and that's a unique and good thing that we do. And so a pop-up site, anyone, you don't need an appointment, you don't need a referral, you can come and get tested. And those are not just to allow individuals to get tested, but also for us to further understand the prevalence in those areas and the prevalence in our county in general. And so you do see 3 sites there coming up, September 27th, October 3rd, and October 10th and 13th. So we can review the numbers. And what you see there is the standard graph. This is Hamilton County, and these are cases. And so each one of those represents the number of positive cases in a day, and the line represents a better number, which is the 7-day average, because there can be a delay in when a test is obtained and when the test is resulted. And so we look a lot at that 7-day average. As you look at that graph, and I know that this has been discussed every week, you see the area early on with lower numbers, and the cause and effect there are related to a significant shelter in place. As we opened up after Memorial Day, we began to see the upswing. So the cause and effect there is the coming out of individuals and the increased spread. You see a red line there, and that is when the mask order and mask orders began to be in effect. And you see it coming down after that. Today, over the last 2 weeks, you see some fluctuations, a little bit up and a little bit down. It's hard to assign cause and effect to those numbers. Certainly increased college, some increased spread through young adults, and you'll see the numbers there. Can account for that, but it's as likely as anything the typical variation around a new average. And so we continue to follow that. On our next slide, you see the reproductive number here for Hamilton County, which is 0.92. I think we've talked a lot about what that reproductive number represents. When it is below 1, it represents a decrease in transmission. When it's above 1, it represents an increase in transmission. That is calculated from our daily case rate, and it's a very complex calculation, but it really relies on our case rate. To the right, you see the 14-county area, and that's how we have been looking at things. We have Region 6, which is the 8 counties of Southwest Ohio. We have 3 counties of Southeast Indiana and 3 counties of Northern Kentucky. So we look at that as a 14-county area, in large part because some of our hospitalization numbers here, as the Commissioner pointed out, are sent in from outside counties. That's great. We are referral centers. We take pride in that. And so there's some fluctuation that is magnified outside the county by patients that we share together. And we do so as health systems, and we monitor that as public health. Our next slide shows the hospitalizations. And so this is the number of individuals in the hospital at any given time and the death rate. And so we have kind of standardized down at about 120 to 130 people in Region 6 in the hospital with confirmed COVID-19 at any given time. Some of that is through improved testing, and some of that is through improved case definition, and much of that is a pretty standard transmission of COVID-19 or SARS-CoV-2 here locally and regionally. On the bottom right are the number of deaths, as was mentioned by the Commissioner. And once again, the deaths from COVID-19, the majority of those also had other comorbidities, but not all. And so we monitor that very closely. And then finally, the Ohio Public Health Alert, which is, has the County of Butler and Preble County above us, and Montgomery County in red, and Hamilton County is in orange, and that helps to advise us on the transmission levels. There's 7 indicators, as have been discussed before. And then we'll kind of move into a discussion. It's actually exciting to begin to even think about vaccine. And so as you very well know, if you're reading the news, that there are many vaccines in various levels of production. I want to say right off that there is currently no vaccine available for COVID-19 locally or nationally, only in trials. And there are 2 vaccines here locally that are in phase 3 trials, which is the trials before FDA approval. We don't know if or when one might be available, but good public health planning and good EMA planning really requires that we prepare to hit the ground running in the eventuality of successful vaccine or more than one vaccine. And we will most likely have more than one vaccine. And as has happened in previous pandemics or outbreaks, such as H1N1, the vaccines or vaccine came out in increments. There are several candidates in various stages of trials, some of which are beginning to show some promise. The CDC has asked states to prepare for possible distribution, including storage and refrigeration, locations, distribution priorities, and methods. Through the Health Collaborative, the local health systems are doing the same. Some of these vaccines, one or two, and possibly the Pfizer vaccine, which may be the first that we see, have some unique cold storage requirements, and we are already anticipating that and have already secured some of the capability for that. Hamilton County Public Health has begun talking about how we might handle vaccine distribution. You may know in the wake of 9/11, certain things called points of distribution, or pods, were created initially to potentially distribute an anthrax vaccine if needed. Those were also used in H1N1, and we have been testing those throughout. In fact, tests occurred last year. Those would be points of distribution, over 100 of those throughout our county, and we also have the capability for drive-through testing sites that not dissimilar to the pop-up testing. Finally, we want to mention the importance of the flu vaccine. Every year we say how important it is to get your flu vaccine. This year it's 100 times important, and in large part because influenza-like illness can be indistinguishable from COVID-19. Influenza-like illness with fever and shakes and chills and muscle aches can very much resemble that, and we need to make sure that all those who can and should get the vaccine. Anyone age 6 months and above qualifies for the vaccine, should get it. There are extra supplies, should be very reasonably available, and so every year we say how important the flu vaccine. This year it's even more important. It's already available, effective and safe. I would remind everyone that when you get the flu vaccine, it does take 2 weeks to build the immunity, to build up the antibodies that are protective. And so just think about that. Sooner is better than later. The typical flu season is October, November through March. We tend to see peaks here and nationally after holidays like Thanksgiving and Christmas, especially in January. So we tend to see our peaks sort of after the first of the year, but it's still important to get your flu vaccine as much as you can. Don't take chances of flu and COVID simultaneously, and we could have an overwhelming scenario. And we, in all our health systems and public health, have been looking at how we can distinguish by laboratory analysis in the emergency departments, flu and COVID-19 as quickly as we can. And so that's a continued effort that we are working on. And then I will turn it back over to Commissioner Dreihaus. Thank you, Commissioner.
Thank you, Dr. Fagans. And you can see the resemblance between Dr. Fagans and Dr. Fauci. Now it's very obvious to everyone. But we really, really appreciate your work. Do give him our regards if you talk to him again. So next we're going to have Nick Crosley. He is the Director of EMA to talk about some of the preparedness that's going on in Hamilton County related to the vaccine.
Thank you, Commissioner Dreihaus. As many of you may know or may not know, we have been activated supporting COVID-19 response since about the 1st of March, officially with the county and the national declaration. It has ebbed and flowed. One of our primary missions at this point is the reception and distribution of personal protective equipment. We are now shifting to looking at what does the vaccine reception and distribution look like. So we're meeting with our public health partners, we're meeting with our first responders and others through the Health Collab to look at, from my agency's perspective, what kind of logistical support is needed of both us, the state, the feds, as well as county government. We've recently met with public health, and we have ongoing meetings. We've talked with our state emergency management agency to see what they're going to be doing. We're studying the CDC and ODH guidance and the information that's coming out, both that's widely seen on the media as well as the reports that we're getting. Right now, with our recently acquired PPE storage site, we're looking at what is needed in terms of being able to receive the vaccine and making sure we have the equipment on hand to do that, what is needed to store it. So if and we don't know yet. So a lot of this is being done around with the caveat that we don't know exactly what's going to happen. But about the only thing I do know is they do have a contract for a national distributor of the vaccine, a company called McKesson. But as we move forward, what will be needed storage? So, and what level of cold, as Dr. Fagans mentioned, what level of cold storage might be needed? So we're working with Hamilton County Public Health on identifying what would be needed. Do we need to go ahead and either lease that space or install that space in our own area? And then from that, what is needed to support that? We get all the way down to backup power, distribution, security, all those kinds of things to make sure that anything we can think of now, as Dr. Fagan said, to be as prepared as possible for that vaccine distribution, that we're ready to go the minute we get it. Understanding, of course, we don't know how many doses we're going to get. We don't know if they'll go directly to hospitals or if the public health system will be required to be able to receive and distribute. But all of that aside, I think, and I've expressed this to the commissioners and I've expressed this to all of our health partners, that as an agency, our job is to sort of help them walk through what logistics look like, how do we acquire those logistics, all the way down to putting vendors in our county purchasing system, which seems sort of elementary, but does require a process, as with any purchasing process. So all these things are slowly coming into place. So our goal is to be ready at the latest by November 1st with as much as we can possibly know, so we can support our public health and health community as they receive and distribute the vaccine to our communities in Hamilton County.
Thanks, Nick. Really appreciate it. So as you can see, we're preparing for the inevitable, which is a vaccine, hopefully sooner than later, but we really don't know the timing. And as Dr. Vegans pointed out, there are some in the last stages of trial, but we've all got our fingers crossed that, because once we see a vaccine, we will be able to leap into the future of trying to combat the coronavirus here in Hamilton County and throughout the nation, and the world, really, for that matter. So, all right, very good. So we're ready for questions, Bridget?
Yeah, Megan Mitchell from WLWT News 5 has a question for public health.
Dr. Fagans.
All right. Can everyone hear me? Hi, Doctor. We're wondering what the county's plan is for Halloween in terms of COVID.
Oh, Megan, great question. In fact, the Ohio Department of Health has their weekly meeting in about 30 minutes. I know that Halloween is on that agenda, and so we should expect some guidance from the state here shortly. So at this point, we don't know what that guidance will be. We can kind of expect it, but we don't have guidance for Halloween. Thank you. Great question.
Thank you.
Next up, we have Ann Sanker from the Inquirer. For, I'm not quite sure. Ann, who would you like your question be directed to?
All right. Good morning, everyone. Thank you so much for taking my call. I'm sorry I was a few minutes late. Commissioner Dreihaus, I wonder if you could tell me once again, where is Greg Kesterman this morning?
He's on another call. I think it's
Okay,
related to I think it's related to infant mortality.
Okay. I wanted to speak to Dr. Fagans once or twice about, had two questions. First of all, what are his thoughts about the president's insistence on herd immunity as a goal for fighting the coronavirus? Do you see that as workable here in Hamilton County? What would that mean?
Well, Ann, great question is usual, and Greg is actually on a statewide infant mortality, and so herd immunity is necessity, but we will not achieve herd immunity without a vaccine. That's been tested over and over. And so herd immunity will require a vaccine, and that's our goal.
Okay, and one other question, please. So my editor, who is a data genius, has said we're now 3 weeks or so with more than 100 cases per 100,000 population, which is a CDC flag for community spread. So what's going on, and how is that being addressed?
So Ann, that's another great question, and we are at a level of community spread that is leveling off, and And even in looking at your daily case rate, you begin to see some variation around. And so we are roughly around that. Probably the biggest contributor to that number is college. And the college age, the 18 to 24 age range. We in Hamilton County report that particular age range on purpose. We report the 4 to 17, which is the K through 12, which by the way are unchanged at this time, and we report the 18 to 24, which is your young adult or college. And so that case rate right now is around 12 to 13%. That is probably the biggest contributor to the number of new cases here locally in Hamilton County and statewide.
And are you feeling good, Dr. Fegans, about where those numbers are going for the 18 to 24 age range, or is that still a something that do we need to apply some further social pressure on that age group to bring those numbers down?
So that's a tough age group, but I'm very proud of our local universities, University of Cincinnati, Xavier University. We are in very much constant contact, not only with the student population, but the athletic departments as well. If you look at local interscholastic sports, the guidelines related to that, the fact that we are able to continue that and possibly even expand, you're not pleased with any new cases, but we are able to keep that case rate from going too high, in addition to opening up some schools and opening up the colleges.
Thank you.
Thanks, Nate.
Okay, Doctor, you have another question from Chris Wederick with the Business Courier.
Oh, hi, Chris.
Good morning. Sorry about that. I was on mute. Doctor, you said there were possibly some special refrigeration requirements for some of these vaccines that are being tested. What do you mean by that? Can you describe that?
Chris, great question. So, at least the Pfizer vaccine that we know has a sub freezer requirement of around minus 70 or 80 degrees centigrade. That's about minus 94 degrees Fahrenheit. Okay, that's a laboratory grade freezer. And it's a unique. We've not had vaccines that had that degree of refrigeration requirement. I do actually know that the Pfizer team is looking at regular temperatures, that minus 20, which is the typical vaccine storage temperature, doing some work with that. But like anything else, when you are in the lab and creating something, you want to go to the most significant, which is where Pfizer is right now. So those types of freezers are available typically in labs. Through our work with the Health Collaborative, the health systems have and are securing those type of freezers in the event that they're needed. EMA is not, but that's a partnership that we have with the health system. So that particular vaccine has a minus 80 degrees centigrade, minus 90 degrees Fahrenheit requirement at this time for both transport and storage. They are packaging all the stuff that goes along with that. We're already looking at supplies of dry ice, as you would, because our biggest goal is that all vaccines, including these, have about a 6-hour life at room temperature. Okay, and we do not want to waste one precious dose of vaccine, and so that's why a lot of this preparation is necessary now. So we know exactly what we are doing.
Thank you. And then I don't remember who was talking about this, whether it was you or Nick Crosley, but I think somebody said, and I just want to make sure I understood it right, that in the past, when the county looked at having to distribute vaccines specifically for anthrax, that it had maybe 100 different distribution points. Did I hear that right?
So, and Nick can also reinforce. So, the POTS, the point of distribution system, was developed in the wake of 9/11. So it's 20 years old, almost 20 years old. And so that was initially developed for anthrax. So that's what we have. Today, we have over 100 POD, points of distribution, in Hamilton County, more than 100.
Great. Thank you. That's all I had.
Thanks, Chris.
One from WLWT. Can you specify what meeting is being held to discuss Halloween COVID plans, and is it open to the media?
It's not. It's a call that we have with local public health districts, and we get a lot of information around that. And it's occurred on Wednesday forever. And so thank you.
And the next question is, could you explain herd immunity?
Oh, great question. So what is herd immunity? And herd immunity is that percentage of individuals in a community that are immune either through infection or vaccination, so that transmission ceases to occur readily. Okay. Every year we get the influenza vaccine because it only lasts for really 6 months, 6 to 8 months, and the flu strain changes. But yet we have achieved herd immunity through the combination of vaccine and people getting the flu. There's different definitions of what percentage of a population needs to be vaccinated in order to achieve herd immunity. For example, measles, which is the most transmittable virus there is, has a reproductive number of 15. You really need 95% or more of your children coming into kindergarten to achieve herd immunity. There have been numbers for SARS-CoV-2 or COVID-19 that could suggest 70, 80, 90%. It's hard to know. But herd immunity is that degree for which we can open things up, that we can reach some degree of normalcy because the virus doesn't readily transmit, both symptomatic and asymptomatic, because there is really minimal to no resistance in the population of a community. So great question.
From Ann Saker.
Thank you. Dr. Fegans, just to touch back on herd immunity, I think herd immunity is not a minority of the population. You have to have, for any communicable disease, you need at least 70 or 80% for almost anything to develop that level of herd immunity, correct?
Yes, ma'am. Yes, exactly.
Okay.
And that's
right.
our entire population. That's everybody.
That's
not
everybody.
A unique part. Yes, ma'am.
Right. And secondly, on the development of the plan for how to refrigerate whatever kind of vaccine, that you feel confident that whatever vaccine we have is going to require extra refrigeration?
Actually, no. So far that we know of, only the Pfizer vaccine has the unique refrigeration requirements. Other vaccines, including the Moderna vaccine, which is being tested at UC, has a standard minus 20 degrees, minus 4 degrees Fahrenheit refrigeration. The other vaccines that we look at have pretty standard refrigeration. It's that unique Pfizer vaccine. The issue is that it's likely that the Pfizer vaccine will be the first one that we get.
I see.
Pfizer has put a lot of vaccines in production. They have production facilities that are already there, whereas Moderna doesn't. And so our conjecture, our prediction, our understanding is that we're likely to get the Pfizer vaccine as the first one that we see, assuming that it passes the phase 3 trial. And so we want to prepare for that. Thank you.
We finished? Okay, great. Thank you for all the questions. It's really interesting to have the experts here talking about the vaccine and how we're gearing up to get ready for what we know is coming. So thank you so much to Nick and for Dr. Fegans for being here this morning. I promise Greg will be back next week. At least he's promised. And I think we need to talk about voting at one of these briefings. We're going to get some experts in either next week or the following to talk about voting. So we're anxious to do that and provide that information as people start to gear up to vote in this community. So more to come on that, but thank you all for joining. Thank you again to Jay and Vicki, and we'll see you next week.